Bring in Lord Adebowale, then recently appointed chair of the NHS Confederation, which represents organisations across the healthcare sector. Good morning. Your take on this
morning, Emma.
Is what? Morning.
Well, that it's a very serious challenge to the whole system. Listening to Dr. Asif, the first thing that comes to mind is that this is a real tragedy. And doctors and not just doctors, actually, doctors, nurses, care workers on the front line from BME backgrounds are clearly suffering disproportionately, and we need to address it. It's been noted by leaders in the health system and by the government. There are a number of inquiries, but I think we really need to think about the fact that this was bound to happen, because it's kind of an episode. But we know that BME communities and BME people tend to suffer disproportionately from a number of illnesses, and COVID has highlighted that inequality. It's shining a spotlight on health inequalities, and these inequalities have existed for decades, and I think we need to address it across the board, because I don't want this to happen again.
This is an important point to distinguish. Are you saying social deprivation and some of the issues around that are the cause here? I know we're still looking into everything to do with this virus. Or are you talking more about genetic factors?
Well, I think, as Dr. Manif said, there are a number of hypotheses as to why this is happening. But if one takes a look at the underlying factors relating to inequalities, you will see that BME groups are overrepresented, and within that, the stress of living in poor communities can in itself damage health. And indeed, there's work done by Professor David Williams at Harvard University that shows the principle of weathering, i.e. living with discrimination day in, day out, has an effect on your health, which means you are more likely to become ill or have long-term illnesses, high blood pressure, high cholesterol, diabetes. These are all illnesses that can be exacerbated by ongoing stress. Now, we don't know the answers, and they're likely to be complex. It's not just one thing. So I think leaping to solutions that are genetic at this point are convenient, and actually inappropriate. We need to do the work, and we need to find out what's happening across the piece, and we need a solution which is also across the piece.
But right now, what can be done? If you are from one of those backgrounds, should you be going to work on the front line? And the issue, of course, when you speak about deprivation, is that people can't afford not to go to work.
Well, I think that's the point, really. And I think we need, so right now, there's a number of things that need to be done. First of all staff should be risk assessed. If you risk assess all staff, the whole point of risk assessment is that it stratifies risk. You identify those risks. So we know that BME doctors are more likely to be working after the age of 70. We know that being over the age of 50 is an increased risk to catching the COVID. If you risk assess all patients, all staff, then you get, first of all, you don't discriminate, but also you would provide different solutions and different interventions for BME staff based on risk, which seems to me that we've started to do that, but we need to do it more, firstly. Secondly, we need to make sure that PPE is available and appropriate for use across all groups, all staff groups, regardless. That seems to me to be a blinding glimpse of the obvious. We need to ensure that we are collecting evidence. So one of the issues, my colleague Professor Marla Rao's been doing a lot of work on this, is looking at how we record data for deaths. Ethnicity is not recorded fully on death certificates, currently in England, Wales and Northern Ireland. Scotland introduced it in 2012, but there are still significant data gaps in how we collect data, so we can actually understand what's happening. And we need to do this now. And we need to start listening to BME staff on the front line. And it's not just doctors, it is nurses, it is care workers. We need to start giving them a voice and listening to how, because these people want to work on the front line, they're doing amazing work, and we need to respect their experience by giving them a voice.